Thank you very much. Good morning, colleagues. Good morning, friends. Welcome to our session, our lounge. So many promises we made, so many promises broken, but this one we would like to protect. This one we would like to deliver on. And we would like to deliver on it, in all ways, by also keeping our promise, that we will keep time, because people have many commitments and then they so have to respect them so in that way. This is the powerhouse, today, a partnership, action, from all levels, WHO, UNICEF, UNFPA, PMNCH, countdown to 2030. And most importantly, our leaders and then representative at country level where things happen and must happen. It is also an intergenerational dialogue because it's about, women, children, and adolescent. That also we make promise, each other to partner, for today and then for the future. And this will be reflected, pretty much, on the agenda. Let's get started with a video. Thank you very much. We've seen again, we ended with, we have to protect the promise. And let me just highlight, very briefly, what are those, some of the very key moments, that we need to protect and then keep. Keep women, children, and adolescents at the heart of the Sustainable Development Agenda. Well, if you look at women, children, and adolescents, maybe we're talking about 3/4 of humanity. There is no way that we can develop. There is no way that we can reach, the SDGs, by excluding what will count almost as, 3/4 of our own humanity. This strategy for women, children, adolescent, and health 2016-2030 means that we are right now at a midpoint, which is the right time to take stock, to see what the gains that we have made so far, but most importantly, to project ourselves, into the future, so that we are sure that we will keep the promise. And that is a bold roadmap for ending all preventable maternal and child death, including stillbirth, by 2030, which is the right thing to do. Should we have a choice? Totally unacceptable that we lose life by giving life. It is totally unacceptable that we compromise our future generation, and by so doing, we compromise also our own humanity. We unlock the vast potential of what I call the 3/4 of humanity for transformative change. And it is most importantly a call to action. And that I think we need to keep that in mind. Here today, we would like to make sure what action are we calling for that we will all be accountable for and then to implement. On that note, let me call on the podium my dear brother and friend, Dr. Tedros, the Director General of WHO.
Good morning. Thank you, my brother Asi, and very happy to meet actually in person like this after a long more than 2 years of separation and isolation. Your Excellency, the Right Honorable Helen Clark, Your Excellency Christy Kaljulaid, more or less, Your Excellency Austin Demby, dear colleagues and friends. Let me start with a few questions. Where were you born? What's your gender? What resources do you have access to? The answers to these questions played a large role in determining your path in life. And they play a large role in every child's ability to survive and thrive. For millions of children, the conditions in which they are born and raised put them on the road to a life with a significantly higher risk of disease and significantly lower life expectancy than children born in more privileged circumstances. The United Nations Secretary General's Global Strategy for Women's, Children's, and Adolescents' Health is our guide for changing that story. Of course, together we have made some gains in preventing the death of women, children, and adolescents. But we know that this progress depends largely on geography, gender, race, and economics. We still have a huge mountain to climb in low and middle income populations and regions, where millions of children die every year largely by preventable diseases. The hardest to reach are those who are also facing compounding crises such as conflict, famine, and other humanitarian crises. And of course, the COVID-19 pandemic had many negative consequences for health, education, social protection, and economic systems. Women, children, and adolescents were hit the hardest. Although many health systems are now recovering from pandemic-related disruptions, we continue to see declines in rates of routine immunization in children and mental health disorders, especially in adolescents. Meanwhile, prolonged conflicts have forcibly displaced more people than at any time since the Second World War. Half of the displaced are children. And across the world, core human rights, including the access to sexual and reproductive health, remain largely out of reach for women and girls. WHO's position is clear. Abortion care is health care, and health care is a human right. Now, at a time where budgets are constricting and rights are retracting, we need increased investment in primary health care and girls' education, enforcement of human rights, and a commitment to prioritizing the health of women, children, and adolescents everywhere, and especially for the most vulnerable. I thank you. Nasi, back to you.
Thank you very much. Thank you very much, Tedros. It cannot be more powerful. Healthcare is a human right. And it is also a way to do it is to ensure girls' education as an entry point, which means then an investment that will be bearing many fruits down the line. And thank you for the commitment of WHO and for your own leadership. Time now for me to hand over to the Right Honorable Helen Clark, that will be conducting a conversation together with Jana, Anshu, and Inga. Helen.
Thank you, RC, Dr. Tedros, ministers, President Kirsty, and everyone who's come for this very important event today. It was 2 years ago that we released the previous Global Strategy Progress Report, calling on world leaders to protect the progress, protect the hard-won gains, protect the most vulnerable. The pandemic at that point was just a few months on, and while we were unsure of the long-term consequences, we did predict that without a deliberate and explicit prioritization of the rights, needs, health, and well-being of women, children, and adolescents, the impact could be devastating. Well, we don't like to cry wolf. Sadly, the report we're launching today shows that our predictions were not far off the mark. Over the past 2 years, we've seen a regression across virtually every major measure of women's, children's, and adolescents' health and well-being, as with so many other determinants of health represented in the Sustainable Development Goals. Since that last Every Woman, Every Child progress report was published in 2020, food insecurity, child marriage, risks from intimate partner violence, adolescent depression, and anxiety have all increased. We are seeing decades of investment and progress wiped away, and we see how fragile the gains have been and how quickly they can be unraveled. Just some of the truly startling facts of just how catastrophic these past 2 years have been for women, children, and adolescents include: since the start of the pandemic, 10.5 million children are said to have lost a parent or caregiver to COVID-19. They are orphaned by the pandemic. The world saw the largest suspension of face-to-face education in history. Millions of children missed out of school, hundreds of millions of children during the pandemic for more than a year. And UNESCO early on estimated that 10 to 11 million girls would never be able to return to school. Approximately 80% of children across 104 countries and territories experienced learning loss because of school closures, and children with disabilities were particularly affected. The world also saw the greatest disruption to immunization services ever known, with an estimated 25 million children unvaccinated or undervaccinated in 2021, 6 million more than in 2019 before the pandemic, increasing, of course, those children's risk of contracting deadly and debilitating diseases. Gender inequalities intensified with increased incidence of adolescent pregnancy and gender-based violence. And now we're facing a global food crisis with the number of those facing extreme acute food insecurity soaring from 135 million people to an incredible 345 million in just these past 3 years, an incredible increase. A total of 50 million in 45 countries teetering on the edge of famine. So these compounding effects of COVID, of the climate crisis and conflicts have resulted in increasing and widening inequalities both across countries and within countries. This is not acceptable. And can I say, in the presence of Dr. Tedros, I'm just so distressed at what is happening to his people in his region of Tigray, to see people denied the right to food, denied the right to essential services, to see people displaced, killed, tortured, disabled, dislocated from their homes because of this terrible, terrible conflict. It's just very distressing and really brings home these graphic images of what happens to children, women, families, people of all ages when these terrible things happen. So this morning, together with our great panelists, we're going to take a moment to understand better what we've seen happen, what we can learn from this, and what mistakes we can't afford to make again. But before we move to the panel, I'm going to ask Jana, my co-chair of the session, also to share her thoughts as an activist, also as a refugee from conflict, and as a young person. Jana, what's the situation as you see it and are living in, and what are your hopes for the future?
Thank you so much, Helen. It's honorable to moderate this session with you today, and dear everyone, dear President Kesti. So my name is Yana. I'm 24. I was born with HIV, and I'm from Kiev, Ukraine. So until February 24, I thought the growing up with HIV was the biggest challenge I would ever face, but I was wrong. After 7 months of this war, millions of young Ukrainians like me have been living with tears, death, and fears. Last Monday, Russia launched dose of bombs against civilian targets in Ukraine. Most of them landed in the center of Kyiv, where I was last week. This is how Russia congratulates the world of the World Mental Health Day. I'm afraid of waking up to the news every morning and finding out that my family, my grandma, my uncle, who are still in Kiev may die from Russian bomb and Iran bombs also. I'm afraid for millions of young Ukrainians, especially young women and children who are alone in foreign country, trying just to survive and wondering what will be left of our families and our country when we return. So today, entire generation of my friends, my peer counselors, young women and children, and students and children have fled their cities, towns, and villages. We're not statistic. Behind each refugee and young person killed in this war, a tragic story of desperation and depression for us, for our family and our country. And millions more, our citizens are still in Ukraine, defending our city and our homes against a Russian army that's raping and killing and torturing with impunity. I'm a founder of Teenage Rises, the largest youth network of adolescent and young people in Eastern Europe, Central Asia. And I hope other young people never experience this toxic cocktail of anxiety, risk, and isolation that we are facing today. The challenges of young people and adolescents face in Ukraine are homesickness, loss of relatives, forced separation from friends, rape, post-traumatic stress disorders, and other mental health issues, sexual and gender-based violence. For young people facing a combination of challenges, like young people living with HIV or other chronic condition, it's even more complex. Every year, adolescents and young people are still dying not from the virus, but from the fears and social stigma created by discriminations. For millions of young people are still safer to hide in these shadows with HIV or being a gay or being a migrant that has come forward to ask for support when you fear and you are going to be treated as a second-class citizen. Even during this war, Teenage Rises continue to provide online peer counseling for more than 10,000 young people, especially adolescents. I'm proud of my work, and our model is based on volunteer, who is supporting the millions of young people we can't even reach. But even after this war is over, an entire generation of adolescents and young people in Ukraine will still suffering with the mental scare of these conflicts for years to come. During and after this crisis, we must ensure that young people and adolescents have access to professional mental health services, especially peer counseling. Ukraine and other conflict zones are the test cases for SDG 3. If we cannot ensure health and well-being for the people of Ukraine or the people of Tigray or North Nigeria of Palestine, they will never reach the sustainable development goal. So today we're just trying to find the results, how we can manage this world. Thank you.
Just testing that we now have power on the microphone. Yes, hearing us at the back. Thank you, Yana, for those very, very powerful words. And we're going to swing into our panel. And with us, we have Anshu Banerjee, Director of Department of Maternal, Newborn, Child and Adolescent Health and Aging, WHO. And we also have Inge Ashing, the CEO of Save the Children International. So first question, Anshu, goes to you. In 2020, when the last report came, we made some awful predictions. 3 years into the pandemic, summarize what we know now.
Thank you, Helen, and for that difficult task. but the report really provides evidence that children and adolescents face unacceptable inequities based on where they are born, as Dr. Tedros said, their exposure to conflict, as it just been highlighted, and also the economic circumstances of their families. We know that in 2020, still 5 million children died every year. And most of these children died in sub-Saharan Africa or in Southeast Asia. At the same time, we know that a woman who delivered in sub-Saharan Africa had 130 times higher chance of dying either due to pregnancy-related factors or in childbirth than a woman in Northern America. These are just unacceptable statistics. And that is why this report is called Protect the Promise. Every woman who delivers has the same right to have a healthy baby, and every child born has to have the same right to have to survive and to thrive. So I want to come back to the first statistic maybe that Helen highlighted around immunization. And we've seen that during the COVID pandemic, the number of unvaccinated or not fully vaccinated children has increased from 19 million to 25 million. And this is in a health program that is maybe one of the best supported health programs for children, maybe the strongest supported public health program overall. And if we have a decline in coverage already in immunization, what about antenatal care, postnatal care, skilled birth attendants, and other services that we're providing for mothers and children? So coming back again, I think it's really, we have to protect the promise we have made here. We have already heard also that millions of children lost out of school. I'm not going to repeat the statistics that Helen has said. But during the lockdown, what we have really learned from the COVID pandemic is the impact on social skills development of children, mental health of children, their nutritional status, their access to services. These are all things that were also provided through schools, and the school environment, and why the school environment is so important for, and face-to-face contact has been so important for children, has just come to the fore here. And I think this crisis really highlighted why mental health for young people is so important. Just to come back to the issue of food insecurity, we know that almost half the population, 3 billion people, actually can't have a full healthy meal every day. Unacceptable. Once again, we know that 149 million children are stunted, and we know that this has increased in the African region over the last 20 years from 54 million children to 61 million children who have been stunted. And we have 45 million children in 2020 who had acute malnutrition. So these statistics, I think, not only show what's happening now, we need to keep in mind also that this is going to have an impact on their development in the future, but also on the next generation. Small babies born with low birth weight, with prematurity, they already are going to transfer that, let's say, to their children in the next generation. So what we're seeing now, what is happening now around the world is not having an impact only now. It's not only having an impact over the next 5 or 10 years, it's going to have an impact over a generation to come. So we have mentioned the 3 C's. We've spoken about COVID, but the 2 other C's are conflict and climate. I know Inga is going to talk more about conflict, but I just wanted to make one point, and following up on what Jana said earlier. We know that the average length of a refugee crisis is around 17 years. This means children for 17 years will be living in under circumstances where they don't have sufficient access to healthcare, to education, but also to a nurturing environment, where they don't have access to playgrounds, where they don't have the emotional backup for them to grow and develop. And so again, here, it's going to have an intergenerational impact. And maybe just to touch also on the issue of climate, we know that, and all of us have seen this on the news, we have had an incredible increase in extreme events, wildfires, floods, droughts. And Pakistan is the most recent example, where we have at the moment 33 million people who are displaced, 16 million children in need, 650,000 pregnant women, of which 73,000 women are going to deliver in the next month. Infrastructure affected. Healthcare workers displaced themselves. Supply chains broken. How are we going to address this? The issue of climate change is becoming more and more urgent and really needs our attention. Thank you, Helen.
Well, thank you, Anshu, and also for reminding us of the long-term and intergenerational effects of these crises that we are witnessing. Very, very sobering. Jana, over to you to ask the next question.
Thank you so much. So today the next speaker, the Inger, she has been working more than 25 years in Save the Children International. So what happened in the world with conflicts today, and what they unpredictable, and what do you know now about the impact of COVID and other crises on the health of women, children, and adolescents?
Thank you so much for that question, Jana. I think the video opening this session captured it all. The number of conflicts in the world are increasing, as we know, and thus the number of children affected. And we are also seeing the conflicts being more and more complex. And we just heard the average range of a conflict being a whole generation. So I think that's just what we need to keep in mind. And conflict is touching every aspect of children's lives and have devastating impact on their health. Earlier this year, I was in Mozambique and I met a 14-year-old girl. She was heading her household, and she had been responsible for her 3 siblings since the age of 11. When she was 11, they lost their parents, and she had to walk for 2 days with her siblings, one of them just being a baby, to get to safety and security. And just sitting there talking to this 14-year-old girl, I have 14-year-old girls myself, and just thinking that the responsibility that she needs to take, being a child herself. And when I spoke to her about what matters in her life, she was really, really determined to ensure that her brothers and her baby sister got access to an education. She was going to school herself. And her dreams was about having a proper house to be able to cook a proper meal for her siblings. And that is what life is about for the children impacted by conflict. That is the reality. And we have so many households like that where children are taking responsibility that no child should be asked to do. We heard Anshu, Helen, Dr. Tedros sharing the statistics. So I'm not going to repeat those again, but I think it's really important to highlight a few things. And we also heard where you're born, your parents, I mean, your background, that is what determines your future. And we know that child mortality in conflict affected states are much higher than in stable settings. Child mortality in countries identified as fragile were on average almost 3 times higher than in non-fragile states in 2019. And with COVID, climate and conflict, that is only increasing. And in conflicts, of course, conflicts are very different depending on where you are in the world. But I think that there are some things that all children face that are common. And that is often a lack of access to proper services, proper health services. And for many children, it means lack of water, sanitation, and hygiene services. And that makes them more vulnerable to preventable diseases and things that we can normally handle as a community. We also heard examples of what it means for pregnant women. And I also want to share, I was in Afghanistan 2 months ago, and I was visiting one of the mobile health clinics that Save the Children are having in Afghanistan. And I sat down and spoke to one woman who was enrolled in our nutrition program. She was pregnant, and her greatest fear was that she was going to lose the child that she was carrying. She had already lost 3 children to hunger, one of them during pregnancy, and just sitting there talking to her and realizing that the extreme decisions that he had to take every day to try to keep her family alive, and also realizing that she would probably be helped and supported this time because she was enrolled in our programs, but she was back for the 4th time. So we have this vicious circle of malnutrition where it's great that we are able to protect and support families, children and women, but we are not addressing the long-term challenges and we are not yet addressing the long-term situation. So I think just keeping that in mind. And Jana, thank you for sharing your example and your experience and the situation in Ukraine is, as in all conflicts, hardest on children. And we know that up till now, we have over 1,000 children confirmed killed or injured in Ukraine. And Ukraine, being a developed country, is also facing a health emergency. And where many people don't have access to essential health services, and where the conflict in itself means that more people need health services, but the situation means that the system's ability to provide it is really negatively affected. And we have over 40 million people in Ukraine in need of health services, and we are unable to provide it. Save the Children, as many other organizations, are working in Ukraine trying to ensure that we can do what we can to support the families and in particular the children. I also want to just say a few words on the progress report, and thank you for that report. I think it's really, really important to highlight the situation, even if it is really devastating to see that things are progressing, not progressing, but actually being, the situation is being paused, halted, or even radically erased. And I really appreciate the strong focus on improving women's empowerment. But I also want to stress, being a representative from a child rights organization, that of course that requires girls, children, to be empowered. And there's a really a strong need to secure women and adolescents' sexual and reproductive health. The linkage between social protection and health service is also a linkage that I think is really critical. And we have often a tendency to see things in silos, but people don't live their lives in silos, and societies don't work in silos. So having this holistic approach that I think is really clear in the report is something that we really welcome. And we did, a couple of speakers before me mentioned the mental health challenges that children and their families are facing now. That is an area that needs more attention that we have given it in the past. And I think that's one of the areas where we really need to come together as a community. And universal coverage of essential health, nutrition, water, sanitation, and hygiene services, and a strong support to the communities themselves, and making sure that we put their needs front and center of our responses, including them in everything we do, is what I think is needed. So thank you.
Thank you so much. Thank you. Thank you for
Thank you so much. We've got one more question to pop to Anshu and Inga, and it's around the impact on women, children, and adolescents of climate change. We can only give you 2 minutes each, but we'd really like to hear your response. Anshu?
Thank you, Helen. And I think the first point to make is, who are the most vulnerable populations when it comes to climate change? And we know they are the populations at the both ends of the life course: women, newborns, children, and older people. And why is this for women and newborns? Well, it's part of their physiology, but that really makes them more vulnerable to heat, infectious diseases, and air pollution. And this results then in poorer outcomes in pregnancy, such as a spontaneous abortion, in stillbirth, and in low birth weight and preterm birth. And we have seen this clearly already documented. And for children also, we know as children are growing that they have higher nutritional needs, but they also breathe more air, let's say, relatively to older people in order to grow. And so we know that 2 billion children around the world are exposed to air pollution, 820 million children are exposed to heat waves, and climate change is increasing also the spread of vector-borne diseases such as malaria, dengue, and other viruses. And so 600 million children are exposed to this. So climate change really has a tremendous impact on vulnerabilities that are related to children. And so climate change will therefore have the potential to really undermine the gains that we have made on child survival and development. And the other point to make also is that climate change is not gender neutral. the impact on women and girls is tremendous as well, because they are responsible for collecting food, for collecting water, for collecting fuel. Sorry, and agriculture is also the most important employment sector for women. And when there is drought, when there are heat waves, women are under much more stress to be able to either work in the fields because they can't change their working hours, let's say, and often also girls have to come out of school, and that prevents them from finishing their education. And maybe just another point to make is that gender-based violence also becomes much more prominent when it comes to natural disasters. Women are less mobile, children are less mobile, they remain where they are, while men can move away from the affected areas, and women and children therefore also have less access to the resources that are being provided, such as relief and assistance. And within that, there is this whole dynamic also of gender-based violence. So I just wanted to put a few of those points on the table. And the last point maybe just to make is the issue of intersectionality, where we look at women, but we look at migrants, we look at indigenous populations. And when we put these factors together, their vulnerabilities are so much higher even than, you know, just looking at one of those factors individually. So tremendous impact of climate change on the health of women and children.
Thanks, Anshu. And Inge?
Andrew said most of it, but I just want to stress that the climate crisis is a child rights crisis, because as we just heard, children are hit the hardest, and it is also driving inequality worldwide and have potential devastating consequences for children's rights in general and children's rights to health. I don't think, I mean, we've all seen the situation in Pakistan, where a climate crisis is leading to devastating health crisis hitting children and their families hard. And this is an unprecedented crisis driven by climate. And after the emerging crisis, of course, there will be a long-term need to rebuild that society. And even if we are all trying our best to address and respond, the funding is scarce. We don't have enough to respond to the immediate crisis in Pakistan, but we will need to invest as a global community in Pakistan for decades to come. And that will have serious impacts and implications for children and their families. Just to give one example of a climate crisis that is hitting the world and children very hard now. One of the things that we Save the Children do as an organization is that we are listening to children. We are co-creating with children, because children are the experts on their own lives. And we just did a big child hearing, or several child hearings. We spoke to more than 50,000 children across the globe. And we talked to them about the things that matter to them, the things that they care about. And it was obvious that children, regardless of where they are in the world, are acutely aware of the climate crisis and how it's leading to inequality and how it is impacting their lives now and for the future. And in Africa and the Middle East in particular, children drew links between climate change, poverty, and increased hunger. I mean, they understand the world as well as we do, and sometimes even better. And they are urging us to change and take responsibility. And many of the children also spoke about the regions affected by conflict and how it even puts them into further risk of violation on multiple fronts. As an organization, of course, we are trying to be part of not just responding to the crisis, but also try to identify the solutions and what needs to happen for us to address the situation. And what I think is really critical is to ensure that we are strengthening health systems and scaling up social protection systems, that we take ambitious and urgent action to limit warming, but also, and maybe this is my most important message for today, that we are recognizing children as equal stakeholders and key agents of change, because we cannot do anything with them, without them, for them, without them. So I think that's what I want to leave you with. Thank you.
Thank you so much. So today's session has reminded me of how important, how my understanding of mental health, of climate change and other has changed. I'm not scared of Russian bombs anymore and Iran's drones, but today I'm more scared when I look into my peers and people from other of our world to have pronounced fears about our future. I think our world has changed more than 7 months in this war than is previously 23 years of my life. It's forever changed my understanding of health, mental health, development. It has also changed my senses of the time that we no longer have 8 years to reach SDG 3. The people of Ukraine have shown that we really care about something and we really want to make it happen, and it's time to take action is now. Thank you so much.
Thank you very much, Inga. Thank you very much, Anshu. But a round of applause again for our excellent panelists. We will continue to protect the promise, and let's show a video.
Distinguished participants, since launching in 2010, Every Woman, Every Child has kept its finger on the pulse of global health, monitoring and promoting access to the quality services that women, children, and adolescents everywhere need and deserve. The 2022 Progress Report of the Every Woman, Every Child Global Strategy highlights what we have accomplished together, despite the COVID-19 pandemic and other crises that have set back efforts to improve health systems around the world. The report also reaffirms what we have come to know, that sustaining access to health services is crucial. Evidence shows that a woman's health before and during pregnancy directly affects that of her child. What a child is exposed to early on can have immediate as well as long-term effects on their development. We know that structuring health programs to support a continuum of services from antenatal through the first 19 years of life can save many lives. Yet gaps in access to those services remain. UNFPA, the United Nations Sexual and Reproductive Health Agency, is working with partners to deliver programs that will help women and young people exercise their reproductive rights and realize their full potential. In 2021, 12.7 million unintended pregnancies were prevented through UNFPA's Contraceptive Supplies Program. During the same time frame, 3 million girls received UNFPA-supported prevention or protection services related to early, forced, or child marriage. And UNFPA is expanding on that progress with increased investment in young people, so they can make informed choices about their bodies, their lives, and the world that they live in. To stem the neglected crisis of unintended pregnancy, young people need to be equipped with the information and services required to make healthy and responsible choices. Strong health and well-being puts power into women and young people's hands. Let us continue to push for stronger health systems that empower women, children, and adolescents, investments that can create a healthier, brighter future for us all. Thank you.
Thank you very much. That was Dr. Natalia Kanem. Let me now invite to the podium Honorable Minister Dembe, Abu, as well as Maziko. And Helen, back to you.
Thank you, RC, and what wonderful words from Natalia Kanem, who's always just so inspirational on her mandate on sexual and reproductive health and rights. This panel, we're addressing critical solutions to achieve SDG 3 for women, children, and adolescents, with a focus on the populations who need support the most. So I'm going to start with a question to Dr. Austin Dembe, the Minister of Health of Sierra Leone. Actually, at PMNCH, we are so excited by what's happening in Sierra Leone. And Minister, we know that your country has introduced the HPV vaccine to combat cervical cancer. Other critical changes in policies to advance and protect sexual and reproductive health and rights, including around female genital mutilation and safe motherhood. Really, I guess we'd love to hear from you about the solutions and policies that are being introduced in your country, because we think what you're doing can inspire so many others. Over to you.
Well, thank you very much, Helen. It's an honor and a pleasure to be here today. I think the story is not as bleak as we all think. I think it's also an opportunity to make a real difference and make change. I think for us in Africa, we don't want to be the continent where everybody refers to as indicators pointing in the wrong direction. We're working hard to reverse that and turn things in the right direction. And I think it's really important to recognize some of those efforts. For us in Sierra Leone, health is not a closed-ended issue. The president of Sierra Leone has agreed that for us as a nation, investment in people, human capital development is vital to everything we do. It's a platform for development. So there are four major blocks in that, starting with education. 22% of GDP is invested in education. Health, 11.6% of GDP is invested in health. Agriculture, and system strengthening overall, just infrastructure development. So for us, health is not just something that's floating out there. It's a platform for development. So I'll highlight some of the key things that we've been working on recently that point in that direction. Just taking, for example, the HPV vaccination. 2 weeks ago, 3 weeks ago, we launched the HPV vaccination, but this effort is not a vaccination as an end in itself. It's a national strategy for eliminating cervical cancer in our country. And we're using the vaccination as a firewall for 10-year-olds. 10-year-olds transition between primary school and secondary school. And so if we vaccinate all of these girls in the country in and out of school, 10 years from now, 20 years and younger people need not worry about cervical cancer. 30 years from now, 40-year-olds and younger need not worry about cervical cancer. So there's a deliberacy around it, and there's a strategic import of it. So we set out by targeting 150,000 10-year-olds. In 2 weeks, we were able to vaccinate 178,000 10-year-olds. And we're also introducing HPV into routine vaccination, such that every time you go walk in as a 10-year-old on your birthday, you get vaccinated. And once a year, just before school starts, we're able to do a mass campaign like we just did. At the same time, we're working on the Safe Motherhood Bill. Cabinet approved the Safe Motherhood Bill, which is a comprehensive bill for mothers' health. And I think some detractors call it the abortion bill, but it's not abortion, it's the health of the woman. And we want to have a comprehensive view of it. Right now, we're having consultations, and it's in a very advanced stage. And we hope that by the end of the year, or early next year, we'll have a comprehensive bill ratified by Parliament that authorizes us to move forward. At the same time, we also have a school health policy. As we'd indicated before, we're looking at health through life stages, and a critical component of the life stages is around the school window. And we're looking at comprehensive school health policy that includes a special focus on young girls. We're ensuring that the hygiene and wash facilities are very, very important. We're ensuring that tampons are available for girls so that they're able to not miss school and have that available to them in the school environment. What's also really quite exciting is the notion of radical inclusion. For education programs in the country, everybody, it doesn't matter where you were born or what your heritage is, you're given a fair chance at education. And we're beginning to see results. Just recently, the schools, high school exams that came through, because we were able to invest about 2.5 million young people going to school for free at the expense of the government. Now you're seeing remote villages scoring higher grades than the urban elite.
Mm.
It really levels the playing field for us. And the other aspect of our radical inclusion is the fact that you cannot punish these young girls twice for their pregnancy. Usually it's intergenerational. So there's a policy in Sierra Leone that we have radical inclusion. Pregnancy should not be an impediment to carry on your education. So you stay in school, you deliver, and you continue with your schooling. It's a very radical process, but it's showing dividends. I mean, some of these girls who've been given a second chance are doing so much better, are much more committed to their education. It's not all rosy. We have one of the highest maternal mortality rates in the world. We have about 14% of these maternal deaths occur in young girls under 20. And that's mostly because they try to terminate the pregnancy. And when it fails, by the time they rush to hospital, it's too late. So what we're looking at now is to ensure that we have an aggressive program that looks at reducing maternal mortality from the DHS survey that indicated 717 per 100,000 to less than 300 per 100,000 in 3 years by aggressive process of focusing on teenage pregnancies, looking at sexuality education, making commodities available to young girls. And if they want to keep the pregnancy, to help them to deliver safely. If they, however, do not want the pregnancy and all other systems have failed, instead of them doing unsafe termination of the pregnancy, offer safe termination of pregnancy to these young girls. And it's at the same time, you know, we're having much more rigid and vigorous laws against rape, against penetration of young girls, and the stiffer penalties. We have one-stop shops that are instituted through the country where you have social services and legal services and some protection and support for young girls so that they don't have to tell their story 4 or 5 times in these situations. So we have about 8 of those. And right now, the First Lady of Sierra Leone has a national program. It's called Hands Off Our Girls that's permeated the whole country, even in remote sites. She is building a 500-bed facility in Freetown, and one major component there is a one-stop shop that provides social protection, legal advice, and counsel and safe home for these young girls. With FGM, it's something that we are working on very seriously in Sierra Leone. The Ministry of Gender takes the lead in that effort, and we provide support to the Ministry of Gender. I think the issues, I consider myself a feminist Minister of Health, and very proudly so. I think the issue of FGM has to be taken very seriously, because in Sierra Leone, the Bondo and the Sande Society are historical institutions that permeate from the main city to the most remote village. It's indeed a feminist organization. It's run by women, it's organized by women, it's a safe home for women. But one major initiation right that's associated with it is appalling, is wrong, and we need to change that within the system. Having said that, we have to be mindful not to throw the baby with the bathwater. Thank you.
Thank you so much, Dembi. It was really appreciated to see how the comprehensive sexuality education and other rights for women is in reality. So the next question to my young colleague, Maziko. So the report puts an emphasis of women empowerment and youth engagement as a way to real change. So as a young activist and leader through the U-Whale and Young Feminist Network, what positive experience have you had with your engagement with that really works? Thank you.
Thank you so much, Yana, for that question. I just wanted to start off by saying that meaningful youth engagement is very important. we're 1.8 young billion young people in the world, and the power of young people is probably the most untapped, yet critical resource that we have at our disposal. And tapping into this powerhouse of human potential can transform the global health landscape. A couple of days ago, I think it was the other day, we had a session in here, and after we had our discussions, there's a young girl that came up to me and she asked me, how do you get a seat at the table like you? And which is bringing me to my next point about meaningful youth engagement. The definition of meaningful youth engagement in itself, it denounces tokenism, yet we see that concept being largely ignored. And we also see, ironically, that meaningful youth engagement is becoming tokenistic. Speaking at a conference is not meaningful youth engagement. And, and to all the young people in this room today, speaking on a panel is not having a seat at the table. That is not what meaningful youth engagement is. Meaningful youth engagement is inclusive. It's mutually respectful. And we see young people as equally sharing stakeholders and as partners. A lot of people, after I was very touched by the speech that you gave, Yana, a lot of people are going to want to take pictures with you. A lot of people are going to want to just have a dialogue with Yana for 2 minutes, and that's what we face as young people. But we need to be part of the decision-making bodies. We need to be part of policies and projects and programs that affect us as young people, and not just at the end of your project when you're evaluating it. We have to be part of the whole cycle from the beginning to the end, and that is what meaningful youth engagement is. And what we have seen as well in Malawi is that once young people are meaningfully engaged, they take ownership on issues that are affecting them. And we've seen that it's also yielded great returns. Getting to my next point, as we think of meaningful youth engagement, we also have to think of youth agency. And we need to simultaneously think of access to information, but then also making sure that young people have access to resources, they have access to skills and capacities, as well as opportunities. It's not enough to give young people information. It's not enough to give young people skills. They also need to be funded. And that's what we're also doing in Malawi through Uwale and also the Young Feminist Network, where we're seeing that, yes, we are giving these young women and girls access to information, but are they really making informed decisions about their bodies and their health if they have intergenerational sex with obviously older men and are not able to negotiate safe sex for a packet of sugar? Are they really making informed decisions? So we're having a multi-sectoral approach where, yeah, give them access to information, but then also empower them economically so that they are able to make their own decisions and make informed decisions as well. Another thing on meaningful youth engagement is we're always talking about inviting young people to the table, which is a bit annoying if you ask me. I mean, how long must we keep talking about this? Oh, invite us to the table, please, please, please. It's so exhausting and I'm so drained, but also just to say that we need to shift where the table is, and the table is not in these conference rooms. We need to take the table to the ground. We need to take the table to the communities. We need to take the table to the people at the grassroots. We need to take the table to the people in hard to reach areas. And I also just wanted to say that inclusive, meaningful youth engagement and meaningfully engaging young people. I think everyone that has attended my other sessions is going to be like, oh, not this again. But we really, not this again, but we really have to decolonize our approach when it comes to engaging young people, especially in rural communities, and also especially when it comes to engaging young people in general. We have to take ownership. We want to be the ones that are directing the narrative of our own stories and our our development and our change. And also just to say that meaningful youth engagement is not only our responsibility, because it's just like, oh, young people, what are you doing to be meaningfully engaged? Really, it's really not only our responsibility. It's your responsibility as well to ensure that the table is longer, to ensure that there is diversity, to ensure that there is representation, to ensure that young people are not just being decorated in rooms, to ensure that we're actually contributing to the agenda. And also, I want to also take this opportunity that if you're not meaningfully engaging young people, then there is obviously a problem. And that's why I'm happy about initiatives like the global consensus on meaningful adolescent and youth engagement, which is an opportunity for stakeholders, organizations, international organizations, and everybody in this room to really make meaningful youth engagement a reality for young people all over the world. Thank you.
Thank you, Maziko. And moving straight to Abubakar from UNICEF and talking about primary health care, delivering what people need when and where they need it. What in your experience, Abubakar, is actually working to strengthen primary healthcare systems, and how can we make them resilient to crises and responsive to women, children, and adolescents?
Thank you, Helen, for these questions. But first of all, I'm delighted to be here, and I'm delighted to see so many allies to UNICEF. I think everyone who spoke has really spoken the UNICEF words. So thank you for that. I know that we're coming from different organizations, but it's really music to my ear. A couple of years ago, when I was still a young doctor, or younger than now, I was working in the country, and we had a young woman who had an ectopic pregnancy, which is a pregnancy outside of the uterus, but the uterus was ruptured. So she was bleeding internally, but she was about 100 kilometers away from where we were working as doctors. And because of security situations, we couldn't basically send her because it was already late. And we had to let her stay the night where she was. And we actually thought that she will die during the night, but there was no way that we would be endangering 5 people just to transport the woman to the place where we were. And in the morning, they called us and said she's still alive. And we were surprised because we actually thought that she would be dying. And then they transported her just 100 kilometers away, but it took them 6 hours to reach where we were. So that's very difficult conditions. And we tried to do the surgery. And the woman, unfortunately, passed away before we even could give her the anesthesia. This was my first encounter where I was the surgeon, but I had a patient dying on the operating table. And it was tough as a medical officer. It took us, I can tell you, Helen, it took us 2 hours to get out of the operating room. We were standing there. If there were a second door in this building where we could escape to get out, because we couldn't explain to the parents a woman who basically survived the night. She was transported 6 hours, arrived where we were. We couldn't save her. She was alive when she went into the war, but she was dead when she was going out. And how do we explain it to parents? Because they all thought that they arrived, and that's a tragic story which probably many doctors can tell you in their lifetime if they have been working with them. And this brings me to the discussions of primary healthcare. The whole essence of primary healthcare is to bring services as close as possible to those communities, at least with the basic services, which should be integrated according to the epidemiological profile of this country. If it's communicable diseases which prevail, then the package will be consistently, dominantly of communicable diseases. If it's non-communicable diseases, this package will be designed with non-communicable diseases. It can include HIV/AIDS, nutrition, mental health, but just the basics ones. No one should be, running around or being worried to actually access these kind of services. And for us to make this happen, we need to invest in primary healthcare. And when we talk about primary healthcare, it is not just the facility-based component. It is also the community component of primary healthcare as designed already in 1978 by the Almaty Declaration. Because there's also these issues of trust element, because for a system to be resilient, it means that the communities need to believe in the system in itself. And it will include as well that some of the programs are run by our younger generations, because they can run their programs better among themselves than we can actually run them. So it's not just a linear program where we take one element and put them together, but it's the consultations between the community and all stakeholders of the communities, the service providers, and the financial people to actually make it happen. So we need to invest in our health workforce so that they don't not just stay within the capitals, so that they go beyond the tarmac. For those who have been working on the African continent or in the developing world, we have these notions of tarmac programs. The program reaches wherever the tarmac is. After the tarmacs, we don't have anything. But primary healthcare is supposed to go beyond the tarmac with a set of package. The other beauty of primary healthcare, it is also multi-sectoral. It cannot just be health. Health issues cannot just be addressed by health solutions. It needs to involve water and sanitation. And as Asi has mentioned already before, or as Tedros has mentioned before, it also needs to include women's and girls' educations. It is about the behavior. There's a very strong component in primary healthcare which goes about preventions and not waiting of having the most complicated cases there as well. And this goes to community engagement, risk communications, and providing a set of packages according to the country's primary needs, as has been demonstrated already by the Honorable Minister of Sierra Leone, that these packages needs to be basically included. And that's what makes the program resilient. Now, everybody is always scared when we're talking about primary healthcare. It costs a lot of money. We can't invest in it. Helen, I would like to differ with the people. We have now tourism to space, people going for tourism to space. But we can't say in this world that we cannot finance primary healthcare. This is unacceptable. What does it tell? What does this tell about humanity? We have money for certain things, but when it comes to a basic fundamental human rights, we have a lot of excuses that there's no fiscal space, that there is an economic recession. And yet we also know that even during an economic recessions, certain ministries never have to cut their budgets. But those budgets which were cut first are education, health, Minister of Women Affairs and Gender. These are the budgets which are very easily cut. I have never seen Minister of Defense budget cut, by the way, in many of those countries as well. So I think it is a shared responsibility within the countries themselves. I think I applaud the Honorable Minister that the budget of Sierra Leone is 11%, but I would still say it's not good enough. Very respectfully. The Abuja Declaration is 15%. And even though that 15% of Sierra Leone's budget might not necessarily cover all the budget, but at least it shows the commitment of governments towards the health sector. And I think this is what we want. It should be shared responsibility. Internationally as well, I strongly believe that the global north, the richer countries, should be supporting the weaker countries to get on track in financing primary healthcare first, because it's very easy to increase the health expenditure per capita in a country in investing in hospitals, tertiary care. But we need to go back and ensure the basics, which reaches communities at the lowest grassroots beyond the tarmac, which I have been discussing already, and really making sure that we are bringing services of where the people are, rather than asking the people to come where the services are basically provided. And that's the only way where we can basically make those services or these health services resilient. That's the only pathway to universal health coverage. And that's the only pathway to achieve the SDGs. And it's the only pathway to make sure that when the next crisis hits this planet, that we are better prepared. Thank you.
So amazing panel, and so much we could pick up on from the points that are made. And I agree with Dr. Demby from Sierra Leone. He's changing the narrative around Sierra Leone. Sierra Leone is leading on rolling out the vaccine against cervical cancer. It is leading on the provision of the full range of sexual reproductive health and rights, including to adolescents, tackling the teen pregnancy issue so directly. It's leading on ending period poverty. We know period poverty is what keeps a lot of girls from continuing their schooling. Enabling the adolescent mother to stay in school. Some countries throw them out. What does that do to a girl's prospect? And then also the leadership on FGM. So thank you, Minister, for inspiring us all with this leadership. Maziko reminded us that meaningful youth engagement is not just about her and Jana sitting on this panel, right? It's about not always having to ask for the place at the table. It's being included as a matter of right and process. And at this point, I should give a shout out to the process being launched later this month by PMNCH, the Global Forum for Adolescents, and it's going to be a sort of 1-year process endeavoring to involve 1 million adolescents in a global conversation from the bottom up, so that adolescents define their agenda on adolescent health and well-being. And then finally to Abubakar, who made such incredible points. The reality is, had the woman who died in front of you been able to get the care nearer to where she originally was, you wouldn't have had to break that horrible news to her family. So primary health care is just so important. You think of all the old sayings, a stitch in time saves 9, or prevention's always better than cure. I mean, these simple phrases sum up the primary importance of primary health care. I'm moved to say, Abubakar, you said you never heard of anyone cutting defense expenditure. When I was Prime Minister, we got rid of the jet strike wing of the Air Force because 35 years of having it had never fired a shot in anger, and it once fired a shot over the bow of a fishing boat which was in the exclusive economic zone. I said, what are we wasting money on this for? And never a cent was wasted since. So there we are. It can be done. And Costa Rica, of course, has no defense force, but these are quite rare examples, I grant you, because if we invested more in human development and human security, maybe we wouldn't have these huge defense bills. That's my humble opinion. So remember that our progress report really is there for advocacy and accountability tool. Lots of information there for all of you who are such wonderful advocates and supporters for women, children, adolescent health and well-being issues. Back to you, Asi.
Thank you very much. Well, what to say? Maybe just, to thank you, Abu, Minister Dembi, and Maziko, and then we will all, as a community of carers here, ponder on those very thoughtful stories, commitments, as well as, the realities of the ground that we need to address and protect the promises we make. So join me again in thanking, this panel. It's now my great honor to welcome Excellency Kersti Kaljulaid, the former president of Estonia, the UN Secretary General's global advocate for every woman, every child. Excellency.
Thank you for being here. Thank you for speaking honestly, and thank you also for providing hope to the Minister of Sierra Leone. And also the greatest thanks possible to all donors who are making life for women, children, and adolescents better globally. Everybody from public and from private sector who has been contributing. Everybody who has been working with these resources given to them to make a life of women, children, and adolescents better. And I'm sure that more than my words, they actually feel that they, while helping these children, that their reward is seeing lives saved, lives made better. And then here we sit today looking at the macro statistics. And it's nothing about those people who strive day in and day out to make life of children and women better. But the statistics actually is not looking good. Even worse, quite a lot of the statistics is not even up to date. We cannot even today properly measure what is the impact, for example, of COVID pandemics on maternal mortality. Again, those who work very hard on these objectives, which we have set ourselves in SDGs, they do everything, but we're backsliding. As we sit here today, it looks highly unlikely that we will achieve our goals. We had a better experience in the past of Millennium Development Goals. But let's face it, Millennium Development Goals were achieved because there was economic development, which was then properly channeled to help the weakest in the society. What is the lesson in this? I think the lesson in this is linked to the governments. As we were told today, if Sierra Leone's leadership decides to help women and children and make this priority, if a government decides to engage meaningfully with youth and is able to build this decision into a program which will work for 5 years, 10 years, longer in the country, only then we have the change. And that's my main worry today. How actually can we incentivize by the resources we have, both from public and private donors, by the people who are willing to work on these issues, how to incentivize these issues to actually impact what national governments are doing? Because finally, as we all know, things do not simply happen if there is no leadership from politicians of any country. Therefore, if I now look at these bad statistics and the resources we are spending, I find the missing link in conditionality. Somewhere, somehow, we must actually make sure that if we support and help, then the donors' money is not outcrowding national resources, but catalyzing national activities. I think we should achieve better efficiency by bringing in conditionality. It's difficult to do because particularly in the places where there is war and conflict inside the country, Tigray was mentioned here, or there is an oppressive regime like in Afghanistan, or there is outright aggression like in Ukraine. It is the question, I mean, nobody has time or will to help women and children in such a setup. And if we add conditionality, then they get even less of a support. But I think most of these macro statistics are influenced not by only these regions, but also by the regions which are relatively stable. And there is where we can actually make these kind of macroeconomic change by making sure that we say, yes, we have a lot of money and we have a lot of knowledge and we have a lot of people who want to work, but they want to work with you, not to work instead of you, the leaders of nations. We must bring this link in. Yes, we must help also women and children in Afghanistan, in Tigray area, in Ukraine, but this is only temporarily so. We must bring on board the leadership, always and everywhere. This is the only way we can change these macro statistics. There is no other way, because outcrowding with the resources of donors, the local capabilities has never yielded good results. And it is true that we have been trying in earnest and very hard to change things. Money from our donors is not increasing. Probably they also discouraged. There are other factors, of course, but they also discouraged. Therefore, I would invite us all to think how to further and more responsibilize national governments by bringing, of course, also into the primary healthcare more kind of statistics which relates to the health of women, children, and also by making it very clear that it is not the responsibility of outsiders. It will always be the responsibility of the leadership and the governments. Outsiders, NGOs, communities is good, but best is national policies. Let's try for that. Thank you for listening.
Thank you so very much, Your Excellency. Colleagues and friends, we've heard a lot this morning. And then I think each of us, when we started to make an introduction, we quote numbers. We quote figures. But more we went into the conversation, we realized, that numbers and figures do not tell the story. They do not tell the story of the woman, that died, almost in your hands, Abu. They not talk about, the plight of many children around the world, including and particularly in those settings that are not normal. It is not normal for a child and an adolescent to live 18 years in a situation of refuge. It is not normal, that when Bangladesh and Pakistan are underwater, that there are children who are suffering most. It is not normal, when the Zambezi River get out of its bed and Mozambique, is suffering, that is also children, and women. Those statistics are only maybe a mute, kind of a way to transmit a reality of a situation that we can never grasp until, unfortunately, we are indirectly, related with that situation, either, in the exercise of our own profession, in our families, as well as also in our communities. So we are all concerned. We are all affected, by that. So let's remind ourselves, all the time that behind each unit of those statistics, behind each number, there is a human face. There is the story, an individual story, a story of a family, and a story of a community. Those statistics, of course, because of the subject matter of this morning, were about women, children, adolescents. But we cannot shift the burden of the response on the shoulders of women, children, adolescents alone. we all have to care. We also must empower men to care. Men to care for their families, men to care for children, men to care for also the adolescent. We make the connection between climate change and also the situation of children and how the report also is relevant in that setting. When Ban Ki-moon in the process of the COP was once asked, what is your plan B if we do not get into an agreement? His powerful response at that time was, I have no plan B because there is no planet B. We have only one planet. We have only one humanity. And that one and only humanity we share, I think we all have to care about it. And we care about it, and then let's keep in mind, those that are hardest to reach, those that are most vulnerable. We call it the last mile in our jargon. But the last mile of problems should be our first mile of response. Let's first start there. We have to be humble, today when we realize, the progress or lack of progress that are being made. But that humility should not paralyze us. That humility should, in the contrary, open us to listen more, to learn from each other, to partner, to continue this partnership that we have, but extend it to a partnership between rich and poor, between men and women, between this generation and the next one, because we have an accountability, for the next generation, and it was heartening to see young people being part of that. You're not only the leaders of tomorrow, but you're the leaders of today, because that is only today that we can do what is necessary to have the future we want. How can we shape, that common future? Now, we need also to take a stand for what is right and not accept the unacceptable. So we've heard it, a number of times. So we need to take action at the same time, everything we said. And that is what the report is calling for. It is a call to action. We need to translate that into action to make a difference. For that, we need leadership. Leadership at all levels. The political leadership, the science, but also the community leadership at all levels that we need to have to make a difference. Because there are these three poles that sometimes seem to be fighting each other, but they then can collaborate and then make a big difference. The science, the politics, and the activism, they are all needed. Politics sometimes, can be a source of the problem, but let's turn it to be part of the solution. Really, again, every woman, every child, every adolescent, let's protect the promise. Let's keep the promise. Let's all be accountable. I was told we have 1 minute left that will give us time to leave the room. Thank you very much.